I'd like to welcome all of you, a huge audience that we have today from throughout the Americas and really throughout the world, welcoming you on behalf of the University of Miami, and in particular, our Institute for Advanced Study of the Americas, and also on behalf of Chatham House that has collaborated with us in setting up this meeting. We have close to 1,000 people who pre-registered for this, which is really record and demonstrates the keen interest that you all have in the welfare of the Americas and the Americas with respect to our world. Richard Horton wrote in his offline last Friday in The Lancet, although many people will search for meaning in the current pandemic crisis, the cold truth is that there is no meaning in what is simply a terrifying and random event. The best we can do is to use this calamity to create the conditions for better and more secure lives and societies. And he tells us, as we all believe that the moment is now, that is why we're here today, to try to talk about systemic responses, particularly focusing on the Americas. We know that the death rate in the world as of about an hour ago was over 85,000 human beings. The economic costs are tremendous. Bloomberg is estimating $2.7 trillion. And from UNESCO, the educational costs are huge. Nationwide closures, which are the right response to containing this epidemic, this pandemic, and flattening the curve, are affecting more than 90% of the world's student population. The world requires evidence-based policy in the face of what is an unprecedented set of challenges. At the same time, we have an unprecedented set of opportunities with which we can respond. The technology we're using today, access to data, our way of communicating around the world are different than what the world has seen in any pandemic in its history. That said, we know that this pandemic will be particularly harsh on those most in need, the poor, women, children, the elderly, of course, and also our migrant populations. We are tremendously concerned about them. We're very, very fortunate today to have two experts in health and health systems who are going to lead our discussion around the Americas' response, systemic responses to COVID. It's my pleasure and honor to begin by welcoming our moderator, Rob Yates from Chatham House. Chatham House is the Royal Institute of International Affairs, a London-based think tank. Their mission is to help governments and societies build a sustainably secure, prosperous, and just world. We've had the pleasure of collaborating with Rob and with Chatham House in the past, and it's wonderful to be able to continue to do so today. He's a political health economist specializing in universal health coverage and progressive health financing. He's the head of the Center for Universal Health at Chatham House and an honorary associate professor in the London School of Hygiene and Tropical Medicine, and a long-term consultant and collaborator of the elders around their universal health coverage program. He holds a BA degree in natural sciences and economics from the University of Cambridge and an MBA from the University of Leeds. Our feature speaker today is President Julio Frank, president of the University of Miami since August 2015. Dr. Frank also holds academic appointments as professor of public health sciences at the Leonard M. Miller School of Medicine, professor of health sector management and policy at our business school, and professor of sociology at the College of Arts and Sciences. Prior to joining the University of Miami, he served for nearly 7 years as the dean of the Harvard T.H. Chan School of Public Health and the T.N.G. Angelopoulos Professor of Public Health and International Development. He was Minister of Health of Mexico from 2000 to 2006, where he pursued an ambitious agenda to reform the nation's health system and introduced what became universal coverage for all of its population, the Seguro Popular, dealing and providing financial protection to more than 55 million previously uninsured individuals. He served as executive director in charge of evidence and information for policy at the World Health Organization and as a fellow at the Bill and Melinda Gates Foundations, among other leadership positions. As a member of the Academy of Arts and Sciences, the U.S. National Academy of Medicine, the National Academy of Medicine of Mexico, and El Colegio Nacional. We are truly, truly grateful that he was able to spend this hour with us in his schedule from leading the university and the university's UHealth system. He is a Master of Public Health and a joint PhD in Medical Care Organization and Sociology from the University of Michigan, and a medical degree from the National Autonomous University of Mexico. Let me tell you a little bit about our run of show today. And I am Felicia Marianal, and I have the pleasure of directing the University of Miami's Institute for Advanced Study of the Americas. We're going to proceed now for about 30 to 35 minutes of moderated discussion by Rob with Julio. We'll then turn to you all for audience questions. And as I turn to you, we've received about 30 or 40 questions over the last couple of days that came in ahead of time. And we welcome all of you to send questions via the chat. I'll be moderating those. And after those 30 to 35 minutes of discussion with Dr. Frank, we'll be dealing several of those questions. We're going to look at 4 different topics today: immediate health impacts of the pandemic in the Americas, other consequences and longer-term challenges, national and regional efforts to combat COVID-19, and opportunities for positive change that can arise from what is a coronavirus calamity in our world. We will focus most of the discussion on responses, and I ask that you share your questions with that in mind. We want to think about systemic responses, and we want to think about innovative solutions. Let me now turn it over to you, Rob.
Felicia, and greetings from my study in London, which is masquerading as the Centre for Universal Health in Chatham House. It's an absolute pleasure to talk to you all today, all over the world, and I'm sure many of you are in a lockdown situation as well and very concerned about sort of the COVID-19 crisis. But as Felicia has mentioned, I think we're going to spend the first part of the chat really discussing the impact, the likely impact of the virus, and you know, the challenges that we face. But I think really what we're looking for is, you know, sort of positive discussions around solutions and maybe even some positive outcomes, you know, that the world's going to be a better place coming out of this crisis. But first of all, President Frank, if I may ask you, you know, looking specifically at the Latin American and Caribbean region, looking at the current statistics, and Felicia has just mentioned the high death toll already that's rising, where do you think the impact is going to be, particularly looking at the health outcomes in the Americas?
Thank you, Rob, and thank you, Felicia, and the Miami Institute for Advanced Studies of the Americas for the opportunity to participate in this webinar. You know, this is one of the most serious pandemics that we have faced in recent memory. Bill Gates called it a once-in-a-century pandemic. Early on, he was anticipating, and it is unfolding to actually become exactly that, a once-in-a-century event. I personally have been involved with 3 previous ones, and I do think that this is by far the one with the biggest consequences. Mm-hmm. And that's a mix of characteristics. Obviously, we're a much more integrated world. We also have a much larger population around the world. But there's also the intrinsic characteristics of this virus, particularly 2 of them. First of all, being a respiratory virus, it is easily transmissible, and this has proven to be one of the most easily transmissible respiratory viruses, much more than the influenza virus. The second characteristic is the fact that it can actually be transmitted by people who are either asymptomatic or have only mild symptoms, and therefore are likely to go around carrying out their normal lives, but yet they're spreading the disease. And this is what accounts for the rapid way in which we quickly moved into community transmission. And couple that with the delay in testing, the basic initial public health response of containment through identification of each case and then tracing of contacts and isolation of the contacts really was quickly overwhelmed, and we have had to move to this generic efforts or policies of so-called social distancing. I prefer the term physical distancing, because the whole point is not to be socially isolated. Actually, we can use the technology as we're doing now to be connected, but it is physical distancing. It's obvious that in a pandemic of this nature is going to affect even more people who are vulnerable. We already know that obviously age is an important predictor of the vulnerability, but there are also socioeconomic conditions that are going to make the response much harsher for some individuals than others. And particularly when one thinks of the physical distancing and the lockdown provisions, it's readily clear that people who live on day by day and depend on their daily work, and that work happens outside of the home, people who are not as privileged as all of us are of being able to work from home, are going to face a very, very tough time, which only underscores the need for very energetic economic mitigation policies alongside the public health mitigation policies. There was just a couple of days ago an analysis for the United States by zip code, and you can immediately see areas where there's a the population structure is such that there's a large proportion of elderly people, but also areas where you have economic deprivation. In the case of the United States, an overrepresentation among cases and fatalities among African American communities. We are seeing that this is a pandemic that is going to particularly affect the most vulnerable, and that's something that needs to be calculated into the response.
Absolutely, yes. And I was just wondering, talking about sort of vulnerable groups, sort of the gender impact as well. How do you see the balance of impact falling between men and women?
Well, I mean, there's multiple dimensions of that. Of course, women in general, in most societies, certainly it's the case in Latin America and the Caribbean, tend to be actually more vulnerable because, whether they are victims of gender-based or intimate partner violence, the more, one issue that's being now identified and recognized is the fact that a negative side effect of asking people to stay home is that in those households where there is some extent of domestic intra-family or domestic violence, where the women are disproportionately the victims of that violence, that is itself exacerbated. In addition, women who participate in the labor market tend to also face, secular discriminations there and are in a more vulnerable position all around. So even though the disease itself there doesn't seem to be any sex distribution of cases of risk, that doesn't seem to be a risk factor. It's everything else that creates the vulnerability that I think puts women at a higher risk than men.
Mm-hmm. And I suppose another vulnerable group that a lot of people are concerned about are migrants and undocumented workers. Do you see that being a particular problem in the Americas?
Absolutely, that is a very big problem. And recently Reuters ran a story that was actually picked up by the New York Times. I was interviewed for that story, but it just portrays the plight of particularly people migrating from Central America, heading towards the United States, seeking asylum, coming out of the violence, the secular violence in Central America. And we already knew that the current administration in the United States had adopted the policy of taking those people, filing their asylum claim, but then asking them to wait for the process on the Mexican side. With the pandemic, they cannot even apply for asylum now. Basically, the border is shut down for asylum seekers. So that's the conditions in the camps on the Mexican side of the border are truly very worrisome. Obviously, there's no hope of any kind of physical distancing. It is placing an enormous burden on the families themselves, and then, of course, the surrounding health system is not ready for that. But it goes beyond. People who are already in the US or in any other country who are undocumented are likely to be exactly that kind of vulnerable groups because they are less likely to show up for healthcare, to seek advice, to seek help, precisely because of the fear that they would be either incarcerated or deported. And this is happening throughout. Mexico has also basically closed its southern border. So all those migratory flows from Central America are basically now stopped. And we have other migrants, particularly from Venezuela. I think this is a situation that makes what was already a humanitarian crisis even worse.
Mm-hmm. And looking at the economic consequences, because we're already seeing governments obviously reacting to the health crisis, but very quickly introducing economic measures to sort of try and protect incomes and sort of keep people working as much as possible. But where do you see the major economic consequences in the Americas?
Well, I mean, one thing that's truly unprecedented is the scale to which the global economy has basically ground to a halt in order to be able to introduce these physical distancing measures and these mitigation measures. And this is going to be a global, it's already a global phenomenon, every economy, and we have a very interdependent global economic system. But if we focus on our region, on Latin America and the Caribbean, the UN Economic Commission for Latin America and the Caribbean has just issued a report. And obviously there is going to be a contraction of GDP. Their projection is if that contraction was 5% of GDP, which is probably on the lower bound of expectations, the number of people in extreme poverty in Latin America and the Caribbean would go from 67.5 to 82 million people. That is an increase of 14.5 million. But if the contraction is 10% of GDP, the additional number in extreme poverty would grow to 22.5. Now, faced with this projections, and remember, this is a key in responding to any pandemic, is contingency planning, is to be able to anticipate and create even worst case scenarios so that you work very hard to avoid them. But the response has been incredibly varied across Latin America and the Caribbean. Some countries, I would know Chile, have responded very vigorously. Mm-hmm. Other countries like Mexico and Brazil are still in denial, have been slow to respond. Political figures have minimized the importance. And so you see an enormous variation. If you just look at the proportion of GDP that countries have devoted to the response itself. So Chile is topping the list with 4.5% of GDP in measures. Mostly these are support to enterprises so that people can keep their jobs, and particularly small and medium-sized enterprises are crucial, and then direct income transfers to families. So it goes all the way from 4.5% in Chile to about less than 0.2% of GDP in Mexico. Wow. And the rest of the countries, even within the Caribbean, I know we have some people from the Caribbean. Trinidad and Tobago is mobilizing 3.5%, according to this report. Barbados 1.4%, Jamaica 1.4%, Bahamas also 0.2%, probably because they've already had to respond to Hurricane Dorian and may have deployed some of those assets in responding to another emergency. So what we see is this great variation across countries.
Sure, yeah. And given the scale of that economic shock and that there's high levels of inequality in the region already, do you fear that this could have bigger consequences, political consequences, potentially rising instability and violence?
Well, as you say, many of the countries are already in a delicate balance, and that balance could really be thrown into an imbalance very, very easily. I mean, it's going to depend on the response from governments. If governments respond promptly to control the pandemic first, the public health emergency, and then rapidly deal with policies and also vigorous policies to deal with the economic fallout, I don't think we will experience widespread instability. I am more worried in the political dimension about the risk, since we are experiencing a wave of populism around the world. I'm already listening to this, to a line of discursive line that is basically trying to reinforce the nationalistic, xenophobic discourse of populists and saying, well, you see, this is a proof of why we need to isolate our country and stop migration because it's people in the move who spread these diseases. And that to me is very worrisome. I'm also worried about countries that declare a state of emergency, given that we are in an emergency, and use that to increase authoritarian elements of decision making and policy making. So I think societies need to be very, very alert so that this is not this emergency, which is real, doesn't become an excuse for a further dismantling of democratic institutions. Particularly, I'm worried in this regard with Latin America.
Mm-hmm. I know this is a big worry for us in Europe as well, and sadly, we're seeing this in some European countries where leaders are taking this approach as well, which of course is totally detrimental to what we're trying to achieve. But we've obviously discussed, a rather distressing situation here and potential doom. But looking more positively, looking forward, what do you think are going to be the best ways that we're going to be able to combat this? And very much thinking that from a healthcare perspective, and you're the architect of the UHC reforms in Mexico, what do you think are the key attributes of health systems that are going to make them more robust in dealing with this pandemic in the Americas?
Well, I would say, every time there's a pandemic by a novel pathogen, a new pathogen, by definition, because it's new, the essential characteristic of the emergency is uncertainty. And in the face of uncertainty, yet people are demanding certainty. They want to know, how is this going to affect me? How bad it is? When we'll be out of this? And what that requires, the response to that requires really two fundamental pillars. One is contingency planning, and the other is good communication. And what we see is that countries that have done that are actually faring well. Contingency planning means that you create scenarios, given that we are uncertain, we're learning as the pandemic evolves, because by definition, we don't know how it's going to evolve, given that it's a new pathogen. So we're learning, but we are creating plans so that we know what to do in each of the scenarios, including worst case scenarios. And the idea of developing worst case scenarios is actually to work very hard to avoid being in that situation. It's a sort of self-defeating prophecy. Success is when you stop that scenario from becoming a reality. But that's why you need to imagine what would happen in those scenarios. And because I'm already hearing people saying, oh, there's an overreaction. That is not true. It's exactly a sign of success when you see countries where the number of deaths and cases is lower than initially projected. It means the strategy is actually working. So the other piece is communication. Dr. Brundtland, with whom I had the honor of working at the World Health Organization, used to say that there are communicable diseases, but there are also communicated diseases. And if leaders don't communicate effectively, they can create a worse situation than the pandemic itself. And that requires constant, concise, credible, and consistent communication. And I think particularly what we see is that what I think gets people very anxious in the face of uncertainty when you see political figures contradicting what technical experts are saying. And we've seen that in many countries. Again, it's a sign of this populist wave affecting the world, because populism, one of its characteristics is this idea of despising technical experts, thinking that technical experts are part of the elite, presenting themselves as people who really know because they're in contact with the good people. And that's very dangerous. We've seen that in many countries. Little by little, reality is forcing some of those leaders to back down. It's happened here in the United States. That was the way it started. Right now, the president here is now fully aware that this is a serious emergency. It's not going to go away by itself. And the US has now started mounting a very vigorous response. Unfortunately, a lot of time is lost. It's happened in Mexico, the same pattern. at the beginning, a minimization, almost a trivialization of the pandemic, contradicting the opinion of experts. Finally, reality imposes itself, and finally, we're there. Brazil, we still have, a lot of minimization, a lot of denial. And the problem is a lot of valuable time is wasted. But what we do see are that countries that have had good plans in action, acted promptly, had consistent communication, actually are being successful. And I think in Latin America, we're still too early to know each country, and I don't want to be unfair to anyone, but I think Chile stands out as an example of a very good response. I'm sure there are other countries that have done that as well. I think if you look in other parts of the world, you clearly see the cluster of Asian countries, South Korea, Singapore, countries and territories like Hong Kong, who, because they, and China itself, who, probably because they had the SARS experience, which is another coronavirus, they were ready, they acted very vigorously with very clear communication. And then you have some of the Western European countries like Italy and Spain, which unfortunately also delayed the response. And by the time they started responding, their health systems were already overwhelmed. It's also happening in your country, in the UK, to a large extent.
Yeah, it very much is. And, we're very disappointed, that we're very proud of our National Health Service. And we feel let down, to be perfectly honest, that we haven't learned the lessons of South Korea. And we look enviously at what Germany's doing. I'm interested that you single out Chile. What would you say that they specifically done that has been so effective? What lessons could they maybe share with the rest of the region?
I think the lesson, both from Chile, but in general, is, you do see those two groups of countries. The ones who decided to act in a timely fashion, not waste time, who didn't waste the time thinking that this was somebody else's problem. Oh, this is all in China, it's not going to get here. Or then minimizing it, oh, don't worry, when the weather changes, this will sort itself out. All of those, the countries that have been successful didn't waste time on that. Move quickly on the two fronts, the public health response, which involved testing. And look at South Korea, quickly testing a lot of people so they never lost control of the cases. And then the detection of cases and isolation. And because community spread was entrenched very quickly, introducing physical distancing and isolation, more broad measures, not just with contacts and people exposed, but broadly for the society. And they were able to mobilize people to do that and for everyone to do their part because communication was clear, was not ambiguous. You didn't have politicians contradicting experts. You had a very clear pathway. And to me, that is the lesson. There are lessons for when we recover, but maybe we can deal with that later. Yeah. I think the lessons for the response is those two ingredients: prompt, energetic action, and clear communication. Any delay is paid many times over later on. Exactly. And the same thing happens with the economic measures that are adopted.
Yeah. And there is a great interest at the moment, of course, in sort of fighting the pandemic to sort of get key inputs. Sort of people are looking sort of for ventilators and test kits, and there's a lot of competition for these scarce resources worldwide. What do you see potentially are the input constraints in the region? Are you concerned about there being specific shortages, maybe in specific medicines in the region?
Well, absolutely. Part of some of the countries that delayed is that by the time they finally reacted, they were trying to acquire particularly personal protective equipment for health personnel, which is critical. If you lose your doctors and nurses and the rest of the health personnel in the fight, not only is that a loss of lives, it's also a loss of life that gets multiplied because you're losing the people who are caring for the rest of the sick. And by the time they reacted, they were facing a global market where it's very hard to procure those inputs. The same thing with ventilators. And that was one of the big consequences of wasting time at the beginning, not getting the health system ready, which is the other side of the response, along with the public health. Again, when we come to lessons learned, I think this is a painful lesson that we really have got to get our act together in terms of being much better prepared with critical inputs and really building national and global stockpiles, which again, you know, countries have been reluctant to spend money on that. But I'm telling you, with a fraction, a minute fraction, an infinitesimal fraction of the economic impact of this pandemic, we could have a global stockpile so that the next pandemic doesn't catch the world as unprepared as this one did.
Yeah, yeah. And can I ask specifically about that then? Because I think there has been a lot of debate, you know, around regional and global cooperation on things like sort of creating stockpiles of inputs like that. Do you see there being increased regional cooperation in Latin America and the Caribbean at the moment? Or unfortunately, is it sort of countries all competing against each other for resources?
Well, there is, I mean, there's both. I mean, the region, the Americas have a very strong office, which is the Pan American Health Organization, the health agency of the Inter-American system, and the regional office of the World Health Organization. It is technically quite competent. I have to say also that many countries in Latin America and the Caribbean have strong epidemiologic surveillance. I mean, I know this firsthand in Mexico. Since the 80s, Mexico has been investing in the epidemiologic surveillance piece has been reasonably good in this, except for the testing, which has been the big Achilles heel of that. But, you know, early detection, that seemed to work. Now, we do need a much more vigorous response to answer your question in terms of global and regional cooperation. And this exactly runs counter to that kind of discourse that I hear some of the nationalistic, xenophobic, populist leaders using the emergency to try to propagate. And remember, in pandemics, it's not just viruses that get transmitted, it's also messages. Mm-hmm. And we need to transmit the message that this is, when there is a global challenge, which is a common challenge to all of humankind, the only solutions have to be global, have to be found in international, including regional cooperation. Mm-hmm. The exemplary case has been the scientific community. Mm-hmm. So as we speak, it is really amazing how scientists from all over the world are cooperating, leaving aside issues of primacy in discovery, of intellectual property. No one is paying any attention to that. It is really the example of what's been really an exemplary global cooperation as we're trying to design better diagnostic tests, drugs, eventually a vaccine, and also innovations in the way of dealing with some of these shortages of personal protective equipment for health personnel and particularly ventilators and other inputs for critically ill patients. Mm-hmm.
I'm glad you brought that up because, you know, in all this doom and gloom, it is great to see that. And I think, you know, already we can sort of hold that up as one positive outcome from this pandemic so far. But again, sort of sticking with the positive theme to finish these sort of formal questions, what other sort of opportunities do you think there may be coming out of the crisis? And one that I'm particularly interested in is universal health coverage. And having seen across the world many great health systems emerge out of crises, you know, not least my own country after the Second World War. Do you see potentially the demand for universal health coverage growing and potentially this crisis catalyzing UHC reforms in any countries in Latin America and the Caribbean and maybe even further afield?
Yes, you know, I always believe that when there is a crisis, particularly a health-related emergency, we owe it to the people who are suffering from the emergency. People who are now, because of the lockdown, are losing their jobs, are losing their way to their means to support themselves and their families. The patients who will suffer through this disease. Obviously, the people who have lost and will continue to lose their lives until this is over. We owe it to all of them to make sure we don't go back to the status quo prior to the emergency. And that means we use the emergency to learn and to make sure that the next time we are better prepared. To me, I mean, all of us in global public health, our big frustration is that every time there's an outbreak, a public health emergency or international concern or a pandemic, there's a lot of attention, there's a lot of resources. And as soon as the emergency is over, everyone forgets about that. So the first thing we need to strengthen here is that part of the health system, which is not as visible and as attractive. It's not the heroic part of surgeons saving lives. It is the silent work of epidemiologists. And we need to assume once and for all that health security is an integral part of national and global security. And we cannot just stop investing the minute the emergency is over, which is what we have done in practically every previous emergency. Again, with an infinitesimal part of the economic cost of this pandemic, I think this is the wake-up call. We could support an ongoing, permanent effort to ramp up capabilities for detection, to ramp up a global stockpile that's sufficiently stocked. And politicians don't like to do that because you can't show it off. But this is what needs to happen. So I would start with that part of the health system, which to me is an integral part. That is the first lesson. Closely related to that is the innovation subsystem of the health system. We need to continue to invest in the platforms for diagnostics, drugs, and vaccines. This is what people have been asking for, so that when a new pathogen arrives, you already have that platform built, and then you mount on that platform the specific characteristics of this virus, and you quickly can design a new vaccine in much shorter time, or identify an effective drug or an effective diagnostic test. But again, this is something we have been calling for, those of us in global public health, but again, very hard to persuade policymakers. I think this time they will listen to that. And then when it comes to the whole health system, this is obviously an opportunity to do exactly what you say. We can't have an effective way of controlling a pandemic when large proportions of the population do not have access. Or like in the case of migrants, who they are legally restricted from that. We need to assume fully that access to healthcare is a universal human right, where the legal or migratory status of people is irrelevant. And by the way, if we do that and we provide protection to everyone, the rest of us are also protected, not just people who are currently excluded. Those of us who are included are also protected. And I think it's very clear that you cannot have an effective response to any epidemiologic emergency if you don't have a functional health system, and that any person who's left behind is, of course, a violation of their human rights and also a risk for everybody else. So no one is safe if everybody is not safe. That to me is the main lesson.
And I suppose a burning question, so many of us are sort of looking at the United States specifically, the country that famously in the OECD hasn't yet, you might say, achieved universal health coverage. Do you think that in the US that we might be inching closer to UHC, maybe with one or two states, using this as an opportunity to catalyze UHC reforms?
I certainly hope so. And I certainly hope that at the very least, the attacks on the Affordable Care Act, which was a big step forward in that direction, not perfect, but that now we turn our attention into trying to improve that rather than dismantle that. And that's not just the United States. Mexico, I mean, part of the reason why the situation in Mexico is so worrisome is it happens at a particularly vulnerable time of the health system, because the populist government, for its first 2 years, introduced a number of measures that have weakened the health system, including rolling back that financial scheme that had been introduced, that over the last 16 years accounted for a fourfold increase in the public expenditure for health. And in an act of budgetary suicide, they decided to cancel that and replace it with a very poorly thought through scheme that was rolled in a very poor way in January. So when the emergency comes around February, March, the health system is particularly vulnerable. And I'm hoping that this will be an opportunity for those countries who are embarking in counter reforms, in dismantling universal health reforms, to stop that and to resume the pathway towards universal health coverage.
Excellent. Yeah, yeah. And again, sort of a potential positive outcome from this, that we're all working in very different ways now, working from home, traveling less, flying less. Do you think people are sort of talking about this fundamentally changing the way that we work and interact? Do you think that's the case, that, we are seeing a sort of a great new opportunity to work differently? And specifically, how do you think this is going to affect higher education and institutions like yourselves at the University of Miami?
Oh, I think this is one of the biggest opportunities. I mean, the use of technology in a world that where now a growing number of people have access to internet, it offers an incredible opportunity. By the way, this is another agenda. We need to make sure that access to the information technology becomes truly universal. If we do that, I think three areas are going to be transformed, and we should not go back to where we were before. One is higher education in general. But this is our big chance. I mean, we at the University of Miami had to migrate our entire set of courses, 100% of our courses, to an online platform. We were getting ready because we have other emergencies here like hurricanes, and we were getting ready to deal with an interruption of classes. We should not go back to the way we were teaching before. We should now take that as a next step in a much improved delivery so that most of the transmission of information is done online. And the classroom interaction becomes much more active and interactive and team-based problem solving. But healthcare is another one. Talking about what we can do to expand universal coverage. One of the things that have happened, positive things, is an exponential growth in the use of telehealth. For a big part of the interactions in the healthcare system, where you can actually use telehealth, including most ambulatory procedures that don't involve an intervention in the body. But then involve an interview and prescription. And that could be an enormous bonus for expansion of coverage if we ensure equity also in the access to these technologies. So to me, that's another big area of opportunity. The third one is, of course, telework. And I think we're all discovering that in many aspects, we can be actually more productive. Not what we're doing now, which is fully on telework, but a blend where so many of the things that we used to do wasting time can be done more efficiently. I think we should, when we come back to a more normal situation, although I don't think we're going to go back 100%, and I hope we don't go back to the way things were before, we will have a better blend in education, in healthcare, and in the world of work between distance solutions, which have been technologically enabled and where the crisis has scaled them, and in-person interactions.
Mm-hmm. Excellent. Yes, so this is definitely what we're finding at Chatham House as well. And for me, it's been quite extraordinary. I've done 3 webinars like this today with very different audiences, and in days gone by, it would sort of take me a day to get there and stay in a hotel, and I'd have to come back the next day. And it's just phenomenal what you can do with this new way of working. So a definite positive, I think, sort of looking forward. Now, I know that as we've been sort of chatting, that Felicia has been sort of collating questions that have been pouring in from the audience. And you've been doing a wonderful job at sort of collating these, Felicia. So can I hand over to you now to ask questions that have been sent in beforehand, and also that some have been sent in during our discussion?
Rob, thank you. And Rob and Julio, that was just an amazing discussion. And in the face of what is so often discussion around death and dying, we're seeing now some thoughts around the future, which is just so refreshing. Let me just tell you that some of the questions that came literally pouring in, you answered as you were discussing. I'll just briefly refer to some of them. Xochitl Castaneda wrote to us, immigrants are one of the most vulnerable populations, not just for the type of work, their low socioeconomic status, but mainly because they are not citizens, and all of what that means in terms of access to services. Naomi Jenkins specifically asked about preparedness for other crises like hurricanes, which Julio, you've already referred to. And we have Henry Olano, who wrote, given the need for more coordinated global responses, do you think this pandemic will lead to WHO having more authority in global public health? For example, managing a global stockpile. If not, how do we get countries to work together in preparation for the next pandemic? Carlos Coelho, how do you think the dismantlation desmantelación of the Seguro Popular scheme in Mexico will affect the possibilities to overcome the COVID-19 crisis and the inevitable economic recession. So many of the questions that we have received online, you've actually spoken to already. Now, we have two questions that I think can be answered together. Isabel Centeno asked specifically, how can NGOs participate and help? And then we also have a question from Victor Cuesta. Which specific actions can pharmaceutical and medical supply distributors do at this point to aid us? Why don't we put those two together and ask you to respond first to those questions?
Sure. And let me just say on the previous ones, the answer to the question of whether some of the authority of the World Health Organization should be enhanced, my absolute answer is yes. I think the current international health regulations, although they have the level of a global treaty, we need to give WHO better enforcement capabilities. And I'm not certainly the only person who thinks that. And particularly avoid at this point that discourse of weakening the multilateral system, which again is part of the populist malaise that's affecting the world. This is the time to reinforce multilateralism, and particularly in the face of global emergencies, I think WHO, the most respected agency of the UN system, needs to have its authority reinforced, and particularly in the question in building a stockpile. Now, it's not just, of course, the public sector, whether it's national or international, like in the case of the UN system, but it's also the civil society and the private sector. And I think both of them have a crucial role. I think civil society, to begin with, first of all, in many of our countries, they are centrally involved in the delivery of care. They are a central and key part of the health system. So they play that intrinsic role immediately. I lead a university, which is a nonprofit organization. We have a huge role in providing health care, particularly in our university hospitals, for very critically ill patients. But the examples are legion around the region, both from primary care all the way to high specialty care. Civil society has a huge role to play. I also think this is the time when civil society needs to mobilize and pressure political leaders to act in a more energetic way. This is what happened in Mexico. I think there was such an outrage about the way the emergency was being minimized and even trivialized that the press and multiple organizations of civil society were issuing calls to stop that and to really take this seriously. And I think a big part of the change in the approach, I credit the civil society. I think civil society will have a huge role as we go out of the emergency in making sure that we do not, that populist leaders don't use the emergency to roll back democratic freedoms. We need to come out of this quite the opposite, reaffirming the imperative of social participation. This is a pandemic where, of course, the technical tools of drugs, vaccines, and diagnostic tests are critical. Telehealth is critical, but it's only going to succeed if people do their part. This lockdown is the largest global mobilization of society, of civil society in history. This pandemic is being defeated by the action of citizens. And I hope citizens don't just give that up, that when we declare victory, it's going to be because citizens observe those social distancing or physical distancing measures, because they isolated if they were positive, because they went into lockdown at huge personal and family cost. But this is a civil society movement. And for private enterprise, particularly the health industry, this is the time to step up, leave the profit motive aside for a moment, and focus. And that is happening. What I hear about scientists who are based in pharmaceutical companies who are racing to develop tests, vaccines, and drugs is a level of collaboration that I hope will carry on after the emergency.
We have a question from Vanya Wisdom. one of the editors at The Lancet. And she says, when planning a response to the virus, how would you define vulnerable groups, being mindful that it's difficult to predict the number of people that will not be able to cope with the physical, mental, and financial difficulties during the course of the pandemic?
Yes, I think when we talk about vulnerable groups, we're talking about groups that were at a higher risk given their condition prior to the onset of the pandemic. And clearly the pandemic itself is going to make that condition worse. And then new vulnerabilities will emerge. I mean, we're only beginning to understand the consequences of extensive lockdown, this phenomenon of domestic violence. We're going to have to deal with that. The mental health implications of that are very complex, and that's part of the agenda for redoubling research, not just in the biomedical side, but also the social science side of the emergency. But we're talking about groups where either because of the attributes of the virus exhibit a particular risk factor, and that, as we know, is age, the two risk factors, and underlying conditions, chronic conditions. A problem in Latin America in that respect is the high prevalence of particularly of diabetes in so many of the countries of Latin America and the Caribbean. Mexico has one of the highest prevalences, but this is a particular problem of our region. And that itself defines a level of vulnerability. But the other is the vulnerability stemming from the social determinants of health prior. And when you overlay groups that were already vulnerable, including for some of those chronic conditions, when you overlay the acute crisis, those are the people that we are concerned. But no doubt that new vulnerabilities will be generated by the emergency itself, particularly in the mental health sphere and issues like intrafamily violence.
The questions are literally pouring in from around the world. And if all of you can stay with us for another 10 minutes or so, and if Drs. Frank and Rob, Julio and Rob, you can stay until 3:40 for 10 more minutes, I think we might be able to get through a few more. Is that all right?
Absolutely fine, delighted to.
Great. Okay, because they are literally pouring in. So, Julio, we have from Fernando Venezuela, who says, "Hola, Julio!" exclamation mark. Can you elaborate on the conflicting balance between economic impact versus health impact from a public policy approach, looking at the influence of health on other sectors and possible pushback?
Yeah, I think it's a false dilemma. And I think one of the most dangerous ways of framing the problem now is to treat it as an either or, which is exactly what we've seen in a number of countries. In fact, a lot of the rationale for delaying the response was to pit dealing with the health emergency as opposite to economic goals. We are dealing with what we're dealing. This is a novel pathogen. We have been predicting that this was going to happen. We knew, for us in the global public health, this was not a question of if, but when it was going to hit us. Now, to deal with that, you require all the instruments of public policy, fiscal policy, monetary policy, to mitigate the impact. Because if we let the pandemic run its course and kill millions and millions of people, the economic impact of that is going to be much worse. So I think, and contrary-wise, if we do the sacrifices that are required, and I do understand it's a big sacrifice to get through this acute phase, the economic recovery will be faster. So I don't think we should think of this as an either or. I think you need the two fronts of, this is a war, it's a two-front war, and the two need to be mutually reinforcing. So I appreciate the question. It's a very critical issue that we need to confront. That's a false dilemma, and we need a coordinated action on both fronts.
Yeah, can I just come in there? I totally agree. And the evidence is so overwhelming that the investment in health is such a driver of economic development and economic growth. Going back to the Commission on Macroeconomics and Health, the Lancet Commission of 2013, and of course the recent World Bank work looking at human capital. So countries wanting to dig themselves out of this economic situation, you know, one of their best investments will be to invest in their health system and you know, to particularly create employment, rural employment, and employing women. On so many scores, investing health makes sense. And I think it's beholden on us in the global health community to make a better case to ministers of finance and heads of state that, you know, this is a very sensible thing to do, not just from a welfare perspective, but from an economic perspective.
Thank you, Rob. We got a set of questions from our colleague in the Dominican Republic, Magdalena Rate, and I wanted to summarize two of them, very interesting questions, and I'll translate. She says the countries in the West that are most effective are around the 70 to 80 day period since the first case. Would we be thinking about something similar happening in Latin America and the Caribbean? And so does that mean that we're going to likely be in a similar situation, or perhaps even worse, by about day 35? And then she says, we haven't gotten anywhere near to the peak of this pandemic or epidemic in the case of individual countries, yet people in Latin America are already speaking about going back to so-called normal ways of life, as they're now seeing in China. So what would going back to normal mean in Latin America and the Caribbean, and how should this be implemented and with what kind of a pace?
Well, very briefly, you know, the advantage of a pandemic, if there is any, is that the countries that have the first cases start providing lessons for the countries that come in later. And Latin America is coming in later. And we need to heed, pay attention, and follow the lessons. And the lessons have to do with what I said. You have two groups of countries. You know, countries that responding early, that didn't let go. Yeah, China is now lifting in Wuhan even, after indeed 86 days. It's a very difficult situation. It's a long period of time. But what we're learning is that it pays off. Because we are way before, we have that mirror to see ourselves. And we need to persevere, be patient, understand that if we obey this, if we follow these measures, we will actually get through that. So I would say that the evidence that other countries are turning the corner should be our incentive to stick and not give up and not listen to the calls for an early return to that so-called normalcy, because then you are risking a second and a third wave. And then, as we were talking, Rob and I, the economic consequences are going to be much, much worse.
Let me turn to a question that we've received from Mark Connolly, UNICEF Honduras. And Mark is asking about insights on the health impacts on children. We know about devastating educational impacts, but what else can we comment on? And maybe we could add into that also some of the gender aspects and other issues related to children. You've also already commented a little bit on the increases in intimate partner violence and gender-based violence. Where do we see health for children and women going as a result of this?
Well, with respect to children, one of the few good things of this virus, or not so bad things, is that for reasons we still don't understand fully, very few children get sick and even less die. It doesn't mean it's zero, by the way, and I think people need to understand it is not zero. But obviously, even though few children are themselves getting sick and dying from COVID-19, they are deeply affected, especially, again, the vulnerable children. Obviously, needless to say, if parents die, that is a devastating. We know that every time a parent, particularly a mother, dies, the risk of small children of dying themselves multiplies several-fold. So children are particularly vulnerable. And then beyond the health aspects, there's the huge disruption of the educational process, without any question. And again, that's where we see the problems of high levels of inequality in Latin America, particularly, where, you know, it is one thing to migrate to online platforms when everyone has access to the internet, but in countries when that is distributed by social class. So those to me are the main vulnerabilities. Obviously, the economic impact afterwards will disproportionately affect children as well. And I think with the gender, we already commented on the specific vulnerabilities for women broadly, especially women who are heads of household. I think have a particular burden if they lose their jobs, and then women who are victims of gender-based violence, with the risk that will increase as a consequence of the emergency itself.
We have a question from an anonymous attendee. Do you see any changes, if any, for medical education for future physicians moving forward after this pandemic? This is an issue that you've written on extensively, and you have the Lancet Commission, obviously, on this. And I wanted to add an extra layer into that and think a little bit about what we're seeing in terms of the need for offering palliative care and also pain relief in our region. We know we've got such a serious lack of access to opioid medications, which are so important for breathlessness, but we also know that we have a tremendous lack of training of our physicians in how to effectively manage opioids, pain relief, and palliative care. How will this experience fit into medical education, or how should it?
Absolutely. I mean, I think the short answer is, well, obviously, including preparedness and response to emergencies should be an integral part, not just for physicians, but all health professionals. Number two, we already mentioned one of the benefits being telehealth as a tool, not to replace the interaction, but as a tool for expanding access where appropriate, mostly in a blended format. I think it reinforces what those of us in public health have been saying all along. It is very important, in addition to the clinical skills to deal with individual patients, that every health professional understands the population basis of health. And I think that should be re-emphasized. And we see a number of recent reforms in education going in that direction. And then, the point you make, Felicia, of understanding the entire cycle of care and not just the diagnostic and treatment aspects, but including the preventive side, the two other extremes, the preventive side and the palliative rehabilitation and palliative care extremes of that continuum. It's going to be very, very important. And as you say, one of the issues here is it's for a lot of patients, the patients who get critically ill, we need at the very least to provide decent palliative care and make sure the death from COVID-19 on a critically ill patient, with the kind of pneumonia that it produces, can create a horrific death. And the very least we can offer is the chance for a dignified death, even if there's little we can do when in that small proportion, but where a lot of people who are critically ill.
We have a question from Jorge Saavedra. Good friend Jorge, thank you for sharing with us. Since many Latin American countries are not receiving emergency COVID-19 aid from the US and Europe, they're looking to China to get aid and credits and income support. Is that good for the emergency response now, or a risk for the future, or some mix of both?
Well, there's a lot of speculation on what's going to happen with the geopolitical order. I'm sure Rob has some insights on this. But I mean, obviously, China is being the first country that is now out of the acute emergency, although they're still in national lockdown. I mean, the borders are basically sealed. But obviously, they are providing that assistance, and that could really change the geopolitical picture. At this point, I think that should only serve to emphasize that we engage, in the rest of the world engage in this isolationist, nationalist, xenophobic discourse at our peril. And countries like the US or the Western European countries who don't want to see that rise of China's influence should understand that this is the time for multilateral cooperation, not for retrenchment from global engagement.
Yeah, just to add that, it's absolutely vital that sort of coming out of this, we don't have a big sort of blame game and sort of people pointing fingers. And, we've seen some alarming signs of that just in the last couple of days, pointing fingers at China and WHO and their relationship, which isn't helping one bit. I think it is fair to say that mistakes were made in China early on in suppressing information around the virus. But the degree of cooperation from the Chinese government since then has been sort of very impressive. And I think, they have tremendous lessons to share around a universal response. That one saw that the big health reforms that came in the last decade in China really came after the SARS epidemic, when they realized the need to re-socialize their health financing system that had become very, very dominated by private financing. And so I think that China have got a lot of lessons that they can share, as has Korea as well. And I think, it is fascinating that it's been a wake-up call for us in Europe, this. I think we thought that we had these great, robust, universal health coverage systems, but, you've just got to look at the statistics, and we haven't done as well. And so I think some humility from OECD countries and rich countries to look to good lessons from Asia, but potentially from Latin America, that we could be learning lessons from Chile on this. So I think, this is the spirit in which we attach this now.
Yep.
So we're coming to the end now. I want to take just two quick questions. Julio, they're very different, but I'll leave you with both of them, and then we can close out. I wanted to take one of the questions. There have been several that have come from our own faculty, and Lillian Mansour, one of our own, asked, how does the President Frank, envision the delivery of courses when we return? And we have another very interesting, I think, from Mexico, from Santiago March, which also, Julio, asks you, what is your view about hospital conversion plans in Mexico? But that might give you a minute to also say something about our own U-Health system and how we're responding here. And then I'll close it out and thank you.
I'll be very brief on the first one. This is what we have seen around the world is the most intense transformation of higher education in such a brief period of time ever. And we would be irresponsible to just go back and not take advantage of this situation. I am a proponent of blended models where we use the technology for the part of education where it's best suited, which is the transmission of factual information, and we liberate the personal interaction for active, immersive, team-based problem-solving engagement by students. And this is our chance to, now that we've deployed those online resources and overcome a lot of faculty resistance, which is natural, to now build on that for a more permanent pedagogical model that is more active. And the same thing, by the way, happens with elementary education, but I think higher education can lead the way there. And it's not just in the US, it's around the world that universities have been forced into this new reality, and they need to build on that for a much more active and interactive, team-based, problem-based learning model. On the hospital conversion, yes, this is a time when you want to release as much hospital capacity, but you need to make that in a mindful way, that you are very clear that what you are delaying are strictly elective procedures. And there are some treatments that are not urgent, but you cannot delay. Obviously, the treatment of a patient with cancer is the best example, okay? And we need to make sure that you are still taking care of people who have that situation. Also, some elective surgeries or procedures in general can become urgent if that delay is prolonged too much and stop being elective and become urgent. So this is very, very, it needs to be crafted very carefully. I mean, since the question was there, that's what we've been doing. I mean, we have a dedicated team that's actually looking exactly at each and every one of those pieces. It's a complex puzzle, but I think it can be done. And all of those who are involved in managing complex hospitals and health systems need to be mindful. This is like playing chess. Every move you need to be thinking of the next 2 or 3 moves that lie ahead and the downside consequences, and be alert for unintended consequences. and have the nimbleness to quickly readjust.
I wanted to give each of you just a chance, one minute. I know we're over coming to the end. We still have almost 500 people connected though. 1 minute summing up, any last words for our audience before I close out?
Rob,
thank you very much indeed, President Frank and Felicia, and it's been an absolute privilege to talk to you this afternoon. My area of expertise has mostly been in Asia and Africa and Europe, so for me to learn so much about what's happening in Latin America has been a real privilege. And I suppose really, I think the most useful message is one I can sort of relay really, that being sort of the next continent over, as it were, with us having come initially from Asia to Europe, is very much sort of say to everyone watching today, this really is desperately serious. And, that we in the UK didn't take this as serious as we thought. Now we look back on footage of our Prime Minister shaking hands with people and boasting about it earlier in March, and sporting events going on that really shouldn't have done. So as we look to the long term, we're hoping that we're going to come out of this with stronger societies with universal health coverage. But for the time being, the message is, do please take this seriously and follow what your governments tell you to do.
Julio?
I will echo that. To me, the message is clear. We will get through this. And when we get through this, we need to make sure we learn the lessons. And to me, as I've said, the lessons are, we need to be ready. We need to invest in the public health systems that will allow us to be better prepared for the next pandemic. This will not be the last pandemic. We need to be there. We need to start intervening early. This sort of wet markets where this whole thing started need to stop. I thought that would have happened after SARS. It didn't happen. This is the time to start taking preventive action throughout the world and investing in those systems of public health preparedness and other measures like the stockpiling that we've talked about. And particularly the investment in science that will allow to build those platforms that will be ready-made for when we hit the next pandemic. Secondly, a lot of research is going on. We will understand better, not just the biomedical side of this, but also the socio-political side of this. And we need to be very alert that we don't have a third emergency, the public health emergency, the economic emergency, and then a political emergency that throws regions like Latin America and the Caribbean, especially Latin America, who fought so hard to build democratic institutions, and that throws us back into the times of authoritarian regimes. And we need to be alert and raise our voices. Civil society will play a crucial role in this effort so that we don't add a third emergency to what's already a very complicated picture.
Thank you both. So as a patient advocate myself, when we work on women's cancers, we remember to think about lives. We remember to think about how many people we lose in a given period of time. We've been with our audience for a little bit over an hour, and according to the estimates that we have from today, that meant the loss of 300 human lives to this virus. What we've heard today are a number of ways in which we can mitigate that number per hour from going up more than it has to, and how much that depends both on good policymaking, evidence-based policymaking, as well as on civil society and each of us as human beings to be part of a common good. We've realized today something that I think is extremely important, which is that viruses are contagious, but so is positivity, and so is work for the common good. We want to thank Chatham House, thank President Frank, thank Rob for being with us today. I'm also very grateful for all of those at the University of Miami who work on the technology, the back office of our webinars that make this possible, and of course our staff at the University of Miami Institute for Advanced Study of the Americas. I'm pleased to share that based on the enormous success that we've had with this webinar, we will be repeating this. There'll be a series of webinars on global health, COVID-19, and thinking long-term towards how we can grow out of this calamity into a series of opportunities to make our world a better place. We did record this session. The recording will be available at the University of Miami Institute for Advanced Study of the Americas website. That is mia.as.miami for miami.edu. And let me just say, we got a number of comments that were really lovely and uplifting, not questions, but mention. And one of them came from Jalis Shakin, who said, I'm really proud of the way the U, the University of Miami, commonly known as the U, has managed this COVID-19 situation. Leadership has shown what we are made of, what Canes are made of. In capital letters, thank you. God bless all of us, and stay safe. Thank you very much, and have a good afternoon, evening, and morning, depending on where you're listening to from your safe homes in different parts of the world.